Allergic rhinitis is inflammation of the inside of the nose caused by an allergen, such as pollen, dust, mold, or flakes of skin from certain animals. It's a very common condition, estimated to affect around 1 in every 5 people in the UK. Signs and symptoms. Allergic rhinitis typically causes cold-like symptoms, such as sneezing, itchiness and a blocked or runny nose. These symptoms usually start soon after being exposed to an allergen. Some people only get allergic rhinitis for a few months at a time because they're sensitive to seasonal allergens, such as tree or grass pollen. Other people get allergic rhinitis all year round. Most people with allergic rhinitis have mild symptoms that can be easily and effectively treated. But for some symptoms can be severe and persistent, causing sleep problems and interfering with everyday life. The symptoms of allergic rhinitis occasionally improve with time, but this can take many years and it's unlikely that the condition will disappear completely. Causes of allergic rhinitis. Allergic rhinitis is caused by an allergic reaction to an allergen, such as pollen, dust and certain animals. Oversensitive immune system. If you have allergic rhinitis, your immune system, your natural defense against infection and illness, will react to an allergen as if it were harmful. Common allergens. Allergic rhinitis is triggered by breathing in tiny particles of allergens. The most common airborne allergens that cause rhinitis are described below. House dust mites. House dust mites are tiny insects that feed on the dead flakes of human skin. They can be found in mattresses, carpets, soft furniture, pillows and beds. Pollen and spores. Tiny particles of pollen produced by trees and grasses can sometimes cause allergic rhinitis. Most trees pollinate from early to mid-spring, whereas grasses pollinate at the end of spring and beginning of summer. Rhinitis can also be caused by spores produced by mold and fungi. Animals. Many people are allergic to animals, such as cats and dogs. The allergic reaction isn't caused by animal fur, but flakes of dead animal skin and their urine and saliva. Work-related allergens. Some people are affected by allergens found in their work environment, such as wood dust, flour dust or latex. Diagnosing allergic rhinitis. Your GP will often be able to diagnose allergic rhinitis from your symptoms and your personal and family medical history. They'll ask you whether you've noticed any triggers that seem to cause a reaction, and whether it happens at a particular place or time. Allergy testing. If the exact cause of allergic rhinitis is uncertain, your GP may refer you to a hospital allergy clinic for allergy testing. The 2 main allergy tests are skin prick test, where the allergen is placed on your arm and the surface of the skin is pricked with a needle to introduce the allergen to your immune system. If you're allergic to the substance, a small itchy spot, welt, will appear. Blood test, to check for the immunoglobulin E, IgE, antibody in your blood. Your immune system produces this antibody in response to a suspected allergen. Preventing allergic rhinitis. The best way to prevent allergic rhinitis is to avoid the allergen that causes it. But this isn't always easy. Allergens, such as dust mites, aren't always easy to spot and can breed in even the cleanest house. It can also be difficult to avoid coming into contact with pets, particularly if they belong to friends and family. House dust mites. Dust mites are one of the biggest causes of allergies. They're microscopic insects that breed in household dust. Pets. It isn't pet fur that causes an allergic reaction, but exposure to flakes of their dead skin, saliva and dried urine. pollen. Different plants and trees pollinate at different times of the year, so when you get allergic rhinitis will depend on what sort of pollens you're allergic to. Mold spores. Molds can grow on any decaying matter, both in and outside the house. The molds themselves aren't allergens, but the spores they release are. Spores are released when there's a sudden rise in temperature in a moist environment, such as when central heating is turned on in a damp house or wet clothes are dried next to a fireplace. At the end, it is requested you to please subscribe our channel.